Hi, good morning everyone. Myself Dr. Pankaj and welcome you all in Pedia Academy by Dr. Pankaj. We are discussing this amazing series on Nelson Pediatrics, previous year's topics which has been asked in NEET SS Pediatric exam. So, uh, Today's discussion we will be discussing progressive familial intrahepatic cholestasis. Let's start with. So, progressive familial intrahepatic cholestasis, PFIC. This is important disease terminology. This is autosomal recessive affecting bile acid transport. Basically, this PFIC is a spectrum in neonatal cholestasis. Cholestasis syndromes, one of the cause is PFIC also. So, as you can see, this is autosomal recessive. Understand what it is. This is disorder affecting bile acid transport. Okay, this is progressive. This is increasing. This is familial, autosomal recessive, intrahepatic. This is intrahepatic cholestasis. The name itself shows multiple characteristics of this disorder. Biological marker, we will see normal or low GGT. Just understand, in normal conditions, if obstruction, biliary obstructions is there, GGT will be increased. But in one condition, GGT can be normal or even low. That is PFIC. You have to think about PFIC. But remember, in variant of PFIC, that is PFIC3, GGT levels are high. This statement is very, very important. Generally, PFIC, GGT is normal or low, but in PFIC3, GGT is very high. Okay, we will classify PFIC basis on the basis of genetic variant, genetic genes and their products. So PFIC is divided into six variant: PFIC1, PFIC2, PFIC 3, 4, 5, 6. These loci and gene are important. As we can see, first thing, see PFIC3 GGT is high. This is important. We have seen only in PFIC3 GGT is high. In other conditions GGT is normal. Uh, in other PFIC, just remember the PFIC 1, 2, and 3, the loci 18Q, 2Q, and 7Q. This is important, just mark my word. And gene for 1 is ATP8B1, the product is FIC1. PFIC2, the gene is ABCB11, product is BSEP, and PFIC3, the gene is ABCB4, and product is MDR3. Similarly, for PFIC4, tight junction protein 2 and PFIC5 FXR and myosin 5B for PFIC6. This table is very important. Many questions has been asked from this table, and just remember, or I will say, mug up this table. So we'll discuss individual PFIC. So as we see PFIC 1, so we have seen from the table gene is ATP8B1 encoding FIC1. Just remember it is associated with pancreatic exocrine insufficiency and sensorineural hearing loss PFIC1. Histology in PFIC1 bland cholestasis is seen, and electron microscopy granular bile or bilar bile is seen. This is important, and complications are end stage liver disease, as we know. So in this PFIC1, you have to remember the gene, pancreatic exocrine insufficiency, SN hearing loss, and bland cholestasis, and electron microscopy showing granular bile and end stage liver disease. Similarly, for PFIC2, we have to remember this gene, ABCB11 gene encoding BSEP gene. Don't remember the full name. So, Histology is showing features of neonatal hepatitis, germ cell transformation, and important early onset hepatocellular carcinoma is seen in PFIC. In two variants, hepatocellular carcinoma is seen. One is PFIC2, other we will see later. Okay, so recurrence liver allograft due to antibody production. So in this PFIC2, just remember two things: the gene and the product, and early onset hepatocellular carcinoma. In PFIC3, the gene is again ABCB4 encoding MDR3. Biochemical marker, this is very important, elevated GGT. Histology is non-specific for PFIC, like inflammation, fibrosis, and ductal proliferation. Again, for PFIC, we will treat this condition with ursodeoxycholic acid. Okay, so this is actually in which condition ursodeoxycholic acid is used in PFIC, so that will be PFIC3. Again, PFIC4, you have to remember tight junction protein 2. Okay, so in this condition, neurological manifestations are also seen. So in which PFIC neurological manifestation seen, that is PFIC4. Scan giant cell hepatocellular carcinoma. So as we seen earlier also, hepatocellular carcinoma seen in type 2 and type 4 PFIC. Okay, in PFIC5, just remember the gene, that is NRIH4 encoding FXR. So this condition shows severe liver dysfunction and vitamin K responsive coagulopathy. This is important, and this prognosis is poor. Okay, yeah. So next, management overview. So as we seen in PFIC3, UDCA is effective. We have seen this is important thing. Surgical intervention, partial external biliary diversion, PEBD, or ileal exclusion in some cases, and liver transplantation is definitive treatment for most PFI. So this was it for today. We'll meet in another video of this interesting series of Nelson based PYT. Till then, do like, share, and subscribe.